The third trimester is brutal. You can't sleep, you can't breathe, you can't tie your shoes. And everyone keeps saying, almost there, like that helps when you still have 12 weeks to go. Today, I'm giving you a real survival guide for weeks 28 to 40. The physical challenges, the mental struggles, and how to actually get through it. Because nobody prepares you for how hard those last 3 months really are. Hey everyone, I'm Diana, and welcome back to Sweet Pregnant. I'm a doctor specializing in women's health, and I'm a mom of 3. And here's what I need to say up front. The third trimester is the hardest part of pregnancy for most women. The first trimester, you're nauseous and exhausted. The second trimester, you feel pretty good. But the third trimester, you're huge, uncomfortable, and counting down the days. Every week feels like a month. Every day brings a new physical complaint. So today, I'm walking you through weeks 28 to 40 week by week. What's happening in your body, what symptoms to expect, and how to survive until your baby arrives. Let's start with the beginning of the third trimester. At 28 weeks, you officially enter the third trimester. Your baby is growing rapidly now, and your body is feeling the strain. What's happening physically? Shortness of breath. Your uterus is pushing up on your diaphragm, giving your lungs less room to expand. You get winded walking upstairs. You can't talk and walk at the same time. You wake up feeling like you can't catch your breath. This is normal. It gets worse before it gets better. It improves slightly when the baby drops lower around week 36. What helps? Sleep propped up on pillows. Move slowly. Take breaks. Heartburn is worse. If you had heartburn in the second trimester, it's intensifying now. Tums or Pepcid? Ask your doctor. With my third pregnancy, I lived on Tums and slept sitting almost upright. Braxton Hicks contractions. These practice contractions are getting stronger and more frequent. Your belly tightens, gets hard, then releases. They're usually painless but uncomfortable. Real labor contractions get stronger, longer, and closer together. Braxton Hicks are irregular and go away when you change positions or drink water. Frequent urination is back. Remember the first trimester when you peed every 20 minutes? It's back. Your baby is pressing on your bladder. You have no capacity. You pee, and 5 minutes later you need to go again. At night, you're up 3 to 4 times. It's exhausting. Swelling, edema. Your feet and ankles might swell, especially at the end of the day. Your hands might swell. Your rings get tight. This is normal as long as it's gradual. Sudden, severe swelling in your face and hands is not normal and could be preeclampsia. Call your doctor. What helps? Elevate your feet. Stay hydrated. It seems counterintuitive, but it helps. Wear compression socks. Avoid standing for long periods. Back pain. Your growing belly pulls your center of gravity forward, straining your lower back. The hormone relaxin is loosening your ligaments, making your joints less stable. What helps? Pregnancy support belt. Good posture. Prenatal massage. Warm baths. Gentle stretching. By 32 weeks, your baby is taking up every inch of space in your abdomen. Everything feels squished. Your ribs hurt. Your pelvis aches. You can't get comfortable. Rib pain. Your baby is kicking your ribs. Or their head or butt is jammed up under your ribs and it's painful. Sometimes it feels like your ribs are going to crack. What helps? Change positions. Gently push the baby away from your ribs. It works temporarily. Sleep semi-reclined. Pelvic pressure and pain. You feel like your baby is going to fall out. There's intense pressure in your pelvis and vagina. This is normal. Your baby is growing, and your pelvis is preparing for birth. Lightening crotch? This is a real thing, and it's awful. Sharp, shooting pains in your vagina or cervix that feel like lightning bolts. It's caused by the baby pressing on nerves. It's harmless but shocking and painful. There's no real fix. Just breathe through it. Leg cramps. Painful leg cramps, especially at night, are common in the third trimester. You wake up with your calf seizing up in agony. What helps? Stretch before bed. Stay hydrated. Make sure you're getting enough magnesium and potassium. If you get a cramp, flex your foot, toes toward shin, to relieve it. Carpal tunnel syndrome. Swelling can compress the nerves in your wrists, causing numbness, tingling, or pain in your hands. This usually resolves after delivery when the swelling goes down. What helps? Wrist splints at night. Elevate your hands. Shake them out when they feel numb. Sleep is impossible. You can't sleep on your back. Makes you dizzy and cuts off blood flow. You can't sleep on your stomach, obviously. You're supposed to sleep on your left side, but that gets uncomfortable. You need 17 pillows to prop yourself up. You're up peeing multiple times. Heartburn wakes you up. The baby kicks you awake. You're exhausted, but you can't sleep. It's maddening. What helps? Pregnancy pillow. The U-shaped ones are lifesavers. Sleep semi-reclined, except that you won't sleep well. Nap when you can. Group B strep test. Between 35 and 37 weeks, you'll have a swab test for Group B streptococcus, GBS. This is a bacteria that about 25% of women carry. It's harmless to you but can be dangerous for the baby during delivery. If you test positive, you'll get 4 antibiotics during labor. No big deal, just an extra 4. At 36 weeks, you're officially full term at 37 weeks. Your baby could arrive anytime now, or you might go all the way to 40 weeks or beyond. Lightening, baby dropping. Sometime in the last few weeks, your baby will drop lower into your pelvis. For first-time moms, this usually happens 2 to 4 weeks before labor. For moms who've had babies before, it might not happen until labor starts. When the baby drops, you can breathe easier. The pressure on your diaphragm decreases, but the pelvic pressure intensifies. You waddle more. You feel like the baby might fall out. Mucus plug. Your cervix is sealed with a thick mucus plug during pregnancy. As your cervix starts to soften and dilate in preparation for labor, this plug can come out. It looks like thick, jelly-like discharge, sometimes with streaks of blood, called bloody show. Losing your mucus plug can happen weeks before labor, days before labor, or during labor. It's a sign that things are progressing, but it doesn't mean labor is imminent. Nesting instinct. Many women get a sudden burst of energy and an overwhelming urge to clean, organize, and prepare. You might reorganize the nursery at 2 a.m. You might deep clean your baseboards. You might alphabetize your spice rack. This is your body's way of preparing. It's normal, but don't overdo it. You need to conserve energy for labor. Anxiety and fear. As your due date approaches, it's normal to feel anxious. You're afraid of labor. You're afraid of the pain. You're afraid something will go wrong. You're also anxious about when labor will start. Every twinge makes you wonder, is this it? Talk about your fears. Take a childbirth class if you haven't. Talk to your doctor. Knowledge reduces fear. Cervical checks. Starting around 36 weeks, your doctor might offer to check your cervix to see if it's starting to dilate or efface, thin out. These checks are optional. They don't predict when you'll go into labor, and they can be uncomfortable. Some women want to know, others skip them. Both choices are fine. Induction discussions. If you reach 40 weeks and haven't gone into labor, your doctor will talk about induction. Most doctors recommend induction between 40 and 41 weeks to reduce the risk of stillbirth. You can decline and wait, but there are risks to going too far past your due date. Discuss your options with your doctor. Let's talk about how to actually survive these last weeks. For sleep, use a pregnancy pillow. The U-shaped ones support your belly, back, and legs. Sleep propped up to help with heartburn and breathing. Nap during the day when you can, except that you won't sleep well. This is your body's way of preparing you for newborn sleep deprivation. For heartburn, eat small, frequent meals instead of 3 large meals. Avoid trigger foods, spicy, acidic, fried, chocolate, caffeine. Don't eat right before bed. Give yourself 2 to 3 hours. Sleep elevated. Keep Tums or Pepcid by your bed. For swelling, elevate your feet whenever possible. Stay hydrated. Drink water all day long. Wear compression socks. Avoid standing for long periods. Monitor for sudden, severe swelling, face, hands, and call your doctor if it happens. For back and pelvic pain, wear a pregnancy support belt. Practice good posture. Hard when you're huge, but try. Prenatal massage if you can afford it. Warm baths, not too hot. Pelvic floor physical therapy if the pain is severe. For shortness of breath, move slowly. Don't rush. Take breaks. Sit down frequently. Sleep propped up. Practice slow, deep breathing. For staying comfortable, wear loose, comfortable clothes. Maternity leggings and oversized tops are your uniform now. Slip-on shoes only. Bending over to tie shoes is nearly impossible. Ask for help with tasks that require bending, lifting, or reaching. Lower your standards. Your house doesn't need to be perfect. The third trimester is hard mentally and emotionally too. You're over it. By week 38, most women are just done. Done being pregnant, done being uncomfortable, done waiting. You want your body back. You want to meet your baby. You want this to be over. This is normal. You're not a bad person for feeling this way. You're anxious about labor, about pain, about the baby's health, about becoming a parent. It's okay to be scared. Talk about it. Don't bottle it up. You're impatient. Every day past your due date feels like an eternity. Everyone is texting you, baby yet, and you want to scream. Your doctor says any day now, and you've been hearing that for 2 weeks. What helps? Distract yourself. Stay busy, but not too busy. Make plans for after your due date. Go to dinner, see a movie. The baby will come when they're ready. Stay off Google. Don't obsess over early labor signs. Talk to other moms who've been there. You're not alone in feeling this way. Trust your body. Your body knows what to do. Your baby will come when they're ready, or when your doctor induces, whichever comes first. You've made it this far. You can make it to the end. In the third trimester, there are certain symptoms that require immediate medical attention. Call your doctor right away if decreased fetal movement. If your baby is moving less than usual, or if you haven't felt movement for several hours, call your doctor. Do a kick count. Lie on your left side and count movements. You should feel at least 10 movements in 2 hours. Regular contractions. If you're having contractions that are 5 minutes apart, lasting 1 minute each for 1 hour, the 5-1-1 rule, call your doctor or go to the hospital. Your water breaks. Whether you're having contractions or not, if your water breaks, call your doctor. You'll likely be told to go to the hospital. Vaginal bleeding. Any bleeding beyond light spotting needs to be evaluated. Severe headache, vision changes, or upper abdominal pain. These can be signs of preeclampsia. Call your doctor immediately. Sudden, severe swelling, especially in your face and hands. This can also indicate preeclampsia. Here's what I want you to remember. The third trimester is the hardest part of pregnancy. You're huge. You're uncomfortable. You're exhausted. Every day feels long, but you're almost there, really. Common third trimester symptoms: shortness of breath, heartburn, Braxton Hicks, frequent urination, swelling, back pain, rib pain, pelvic pressure, leg cramps, carpal tunnel, insomnia. All miserable, all normal. What helps? Pregnancy pillows, small meals, compression socks, support belts, elevation, rest, lowered expectations. Mentally, you're allowed to be over it. You're allowed to be anxious. You're allowed to want it to be over. You're growing a human. Cut yourself some slack. You will get through this. One day soon, you'll be holding your baby. This discomfort is temporary. And one day, years from now, you'll barely remember how hard this was. If this video helped you feel less alone or more prepared, hit that subscribe button. My next video is all about what to pack in your hospital bag and what's actually a waste of space. Drop a comment. What week are you? What's your biggest third trimester complaint? You're almost there. You've got this. I'll see you in the next one.